Two studies were presented at the annual San Antonio Breast Cancer Symposium, building on an earlier observation that bisphosphonates, the drug prescribed to reduce bone loss, might also reduce breast cancer risk. I spoke to Dr. Rowan Chlebowski of the Harbor-UCLA Medical Center about his study and one performed in Israel.
The background is that bisphosphonates are used to build up the bone, are in very common use in postmenopausal women who have lost bone. But in a randomized adjuvant trial reported last year, there was a suggestion that breast cancer recurrences were reduced by zoledronic acid, including new cancers in the opposite breast, which reflect new breast cancer primaries. So we found that in the women who were bisphosphonate users, there were 31% fewer invasive breast cancers than in the women who were not bisphosphonate users.
The second study was led by Dr. Gad Rennert of the Carmel Medical Center in Haifa, Israel. He and associates examined prescription and medical records for more than 4,500 postmenopausal women. They found that those who had taken a bisphosphonate for at least a year had a 29% reduction in breast cancer risk.
The numbers were remarkably similar. In the WHI trial, there were 31% fewer breast cancers seen in women who are bisphosphonate users versus not users. In the case control study, when you look at the women who had breast cancer, they were 31% more likely to not be bisphosphonate users than the women that didn't develop breast cancer.
Okay.
And this is, of course, not a randomized clinical trial. This is a cohort study, hypothesis generating, but there are a number of signals, as we heard from that there may be reasonable mechanisms, and this may be a plausible biological finding.
If you could discuss for us what you think the possible mechanism might be for why bisphosphonates might affect a woman's chances of developing breast cancer.
Yeah, the short answer is we don't know, but there's many biologically plausible mechanisms. So one is an effect mediated through bone by shutting down the bone. You change the circulating growth factors, or we saw factors that will influence the stroma of the tumor. So that's one mechanism. The other is angiogenesis inhibition, which bisphosphonates do, and that stimulates growth and metastatic spread of tumors. And the third one would be immunological, which is stimulation of gamma delta T cells, which can attack and influence cell-mediated attack against the tumor cells.
Do you think that in a woman who maybe doesn't quite have osteopenia, so she doesn't quite meet the threshold for being prescribed bisphosphonates, but maybe has a high risk of breast cancer, is there enough to go on in these studies to suggest that she discuss with her doctor the idea of maybe starting this type of therapy?
Well, I think it might be a little premature for that. There's a drug already approved for breast cancer risk reduction in postmenopausal women, which would be raloxifene in that setting. But if a woman, say, is a candidate for osteoporosis therapy or osteopenia, and this might be another factor that she would weigh in terms of her decision of whether she wanted to start or not.
This is Betsy Bates from Global Medical News Network, reporting from the San Antonio Breast Cancer Symposium.